Doctors of Reddit, what was your dumbest I am Verismit patient experience? RN here. I see some crazy stuff, but one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 pounds. Diabetic, heart disease, you name it. Anyhow, I'm at the computer going over some admission questions with him and his 10 family members who are crowded in the room with him. A few minutes and he starts complaining that he's thirsty. He needs something to drink right now. So I get on my phone and call the nurse assistant and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams no, no water. He's allergic to water. Well, this is gonna be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy. The next question the wife had was, where are we all supposed to sleep? The whole family, 10 people, were planning to stay at the hospital with him. Was working at a clinic. I was speaking with a non-controlled diabetic patient about her sugar intake and she said she drinks a 32-ounce soda every day. I ask her if it's regular or diet and she replies with it's half regular. I let the ice melt first so there isn't as much sugar in it. Sorry, but that isn't how it works. I have had several arguments with diabetics about Coke Kool-Aid sweet tea versus those made with artificial sugar. I tell them, look, don't drink sugar. If you have to have something like that, use an artificial sweetener. No way. That stuff is poison. It will kill me, mom. Your A1C is 14. Sugar is already killing you. I had a patient who was a completely non-compliant diabetic, smoker, morbidly obese, who had his first heart attack at 45. His blood pressure was also super high, and instead of taking his antihypertensive medications, he went to the gym. In the gym, he would sit in the sauna for a very long time, and sweat a lot, and lower his blood pressure by becoming dehydrated. I have one. I got this from my friend, who is a doctor on the children's ward in a rural hospital. These parents bring in their child whose hair is infested with lice. The lice was visible to the naked eye and could be seen crawling on the child's clothing. While the medical staff examined the child, in order to determine a course of action, they discovered the child was covered in a white powder and smelled heavily of chemicals. They asked the parents what were the substances and the smells emanating from the child. The parents said, quite matter of fact, it was Savine powder and flea and tick spray they used on their dogs on the family's farm. Needless to say, social workers were notified about this case. Had a neighbor in rural TN who was convinced that the best way to treat her child's head lice was to comb diesel fuel through it, and that doing it in an enclosed living room while smoking cigarettes was acceptable. She was baffled when CPS took her kid away. 70-year-old female tripped and fell 2 days ago. She came in with hip pain but reports after the fall her nose was bleeding. She had landed on her nose. About a year prior, her dentist had messes up an infraorbital nerve block and caused some swelling in that region, but that all was resolved. This old lady is now convinced her nosebleed after falling on her face is related to an infection from the dental issue a year ago. After multiple back and forth on the etiology of the nosebleed, she became the first patient I raised my voice and put down an authoritative no, you are wrong. Just stop it. This has got to be the medical equivalent to the update you installed on the computer a year ago is making it run funny. Get over here and fix it. I work for an optometrist and it was the month before school started and a woman brought in her son to have his eyes checked for the first time. Seems like a pretty reasonable thing for any parent, even if he was a little older than usual for a first eye exam. Better late than never, I guess. The mom was well spoken and appeared fairly intelligent. Everything went as normal. The doctor examined the boy and ended up prescribing glasses. When the doctor was explaining to the mom that her son had to wear his glasses all the time since he's nearsighted and basically can't see clearly past 5 feet in front of him, and will definitely need glasses for school. For some reason this caused a switch to flip in the mom and she spazzed out on the doctor, saying that her son doesn't need glasses and that the doctor is only saying that he does because he wants to sell glasses. She says that she only brought her son in because there was some form for school that needed to be filled out and that doctors are all a con artist trying to push unnecessary medications and interventions. The doctor tried to calm her down and explain that he's only trying to help them but that she was free to get a second opinion and gave her a copy of the kid's prescription and sent them on their way. About 4 months later the lady is back asking for another copy of her son's prescription. Apparently the first semester midterm results were in, and her son failed them all because he couldn't see the board in his classes and needs glasses. Not a doctor, but I'm a nurse who worked in the or at a trauma center, was doing surgery on a 19-year-old who tested positive for MNC, who was grilling the anesthesiologist about every drug we were going to use in surgery because he doesn't like putting chemicals in his body. Gotta stick with that organic, fair trade, non-GMO Coke. Most of my own stories go along similar lines to patient has chest pain driving a coach load of school children. Thinks it's indigestion, swigs bottle of Gaviscon, later diagnosed with a huge heart attack. My favorite ever story from a colleague: a patient comes into A&E with abdominal pain. As part of the workup he gets an abdominal x-ray which shows the problem as clear as day. The colleague has then proceeded to remove, from the patient's rectum, an 8-inch replica of Nelson's column, the statue in the center of Trafalgar Square, London. On showing it to the patient, the response was, "Oh, that's Nelson. He lives up there." I've got two stories that stick out in my mind. The first is the mother of a toddler who came into emerg. The kid had cruddy green bloody stuff coming out of his left nostril, and a lot of redness and swelling of only the left side of his nose and the adjacent cheek. Mum was sure he caught a sinus infection and just wanted some antibiotics. Now I know some kids like shoving whatever will fit into their body orifices, and that this was more than likely given the one-sided nature of his condition. But Mom was insistent that he never puts things in his nose. It took some convincing, but I finally got her to let me take a look. Gave a squirt of midazolam in the good nostril to settle him, then dug with some tweezers through the crud until I pulled out a big Olay button battery. It would have been burning his nose for a couple days. Hopefully he healed up well. Side note: if a kid swallows a button battery, it can do a similar thing to their esophagus. This is an emergency and needs to be dealt with ASAP. Patient had a hard time getting pregnant. Finally conceived but miscarried. Patient has a D&C so she can try again, this time with medical intervention. We monitor her blood to ensure the pregnancy hormone is gone before beginning treatment, but she keeps coming back with higher levels of hormone. Docs are worried because she might have some retained placenta or pituitary disorder, and this could be super bad for future fertility. We call her in for a conversation about the hormone levels not going away. After talking together about what might be wrong, they are going to go home and think about further tests. She said, "I need to go. I have an appointment at the weight loss center for an HCG shot." Turns out that she is on the HCG diet. HCG is the pregnancy hormone. And this was after an hour of the docs saying, "We don't know why you have these constant high levels of HCG in your blood and we are worried." Patient inquiring about birth control was adamant she wanted an IED. I mean, she probably wouldn't get pregnant after that. Had a young woman with recurring UTIs that began after a recent partner and with no STDs. Went through the standard questions trying to figure out what could be causing them and eventually found out she had been lubricating with jelly, not KY jelly. The mix-up had literally been a joke on house. It took me some effort to keep a straight face, but we eventually resolved the problem and she stopped getting UTIs. Oh lord, I'm British so didn't think jam straight away and was just imagining someone trying to get jello type jelly to stick to their bits. Oh, I have two good ones that come to mind. Clinical pharmacist here BTW with one story in the ER and one in the pharmacy. A physician told me this one. 16-year-old boy presented to the ER with an extremely swollen discolored penis. Apparently he has been using his mom's insulin needles to draw blood out of his arm and inject it into his own penis. He thought that adding blood would help increase his size. His penis was terribly infected and he was hospitalized for a week or so. 2. One day in the pharmacy, a girl comes to the counter requesting a refill for her birth control. We pulled up her profile and realized we couldn't refill it because she just got a 28-day fill less than 2 weeks ago. When we asked what happened to the other one, she said she was out. Apparently, both her and her boyfriend were each taking a pill each and was adamant that was how they needed to prevent pregnancy. Apparently he has been using his mom's insulin needles to draw blood out of his arm and inject it into his own penis. His penis was terribly infected and he was hospitalized for a week or so. Frick, that is just gruesome. I work in the ER. We had a very pregnant patient come in needing stitches in her vagina. Turns out she was a realtor and didn't want her water to break while she was showing a house, so she put a glass cup in her pants to catch the water. Instead of using a pad or an adult diaper, she went for a glass cup. She sat down while showing a house and sure enough, it broke and cut her up pretty bad. Between the guy putting arm blood into his penis and now this, I don't think I'm gonna see my genitals again for a couple of days. I'm a corpsman, not a doctor, but I once had a patient tell me that there was no credible research that smoking was bad for one's health. Okay. 80 plus YO. Patient who was declining with multiple diagnoses and about 3D cubitus ulcers. Daughter was adamant that her father be kept on his strict paleo diet because that would supercharge his healing. She had a stack of diet books. He simply wasn't getting enough nutrition to heal the ulcers. He didn't like the diet at all. BTW. At some point you kind of have to stop being polite and just tell patients' family members bluntly that you don't have time for this crap and what you recommend, and they can do what they want and just document everything. It happens a lot, but she sticks out. I am a dental student. One patient in particular is pathological liar. During one visit, they claimed to have gone to medical school. Next visit was that they did dental army. Last visit was that they had a PhD. The patient will say things like, "Hey doc, do you need me to move my head mesial or distal number? I need you to move your head right. Hey doc, are these cavities being caused by the anaerobic pathology microbes number? They are caused by you eating snacks all day and not brushing." A patient was admitted for anemia and a localized cancer was found. She was referred to surgery so she can get cured from her localized cancer, and she started telling everyone that it was the doctors who caused the cancer and that she was doing just fine before coming to the hospital. She lectured the surgeon and my colleague, who pleaded her to get her surgery so that the cancer doesn't advance, and yet she refused, saying she knew better and probably didn't even have cancer. Some people. This kind of reminds me of my brother. He told me that when he was younger, 5 or 6 years old, he thought that when a doctor diagnosed you with a disease, it means that they actually gave you that disease. The only difference is, he quickly realized this wasn't the case and didn't become a freaking idiot like this lady. Nurse here. The number of American 20-something males who don't know what circumcision is ridiculously high. They think that boys are born circumcised. Evidence. New fathers and mothers asking me what's wrong with their newborn son's penis. He still has his foreskin. Many parents choose to have it removed when the baby is a couple days old. It's called circumcision, often followed by a parent's question, "What's circumcision?" That's when I face palm. Dead serious. We talked about circumcision in my grade 6 health class, but saw any pictures. I had absolutely no idea until I was in high school. I knew what it was but had nothing to compare it to. This was pre-Google. Was working at a pediatric urgent care. Family brings in their 3-year-old unvaccinated son with autism for a weird rash. They couldn't give me any reason why when I asked them about his vaccination status. Said it before, I'll say it again. Had a patient insist I didn't have a heart attack. I had a myocardial infarction. That's just the technical term for a heart attack. Genius. Patient had an anoxic brain injury from drug overdose. She was 23. Her father demanded a brain matter transplant and oxygen directly put into her brain to fix it. But then he decided they would trash and peg her, send her to a nursing home, and wait for a cure, because we didn't know what we were doing. I was a unit secretary and nurse aide on a radiation oncology unit in the early 2000s. We had a patient show up through the year and was admitted for emergency radiation treatment. She had a massive fungating mass in her mouth that had consumed half her head. When the rad-onc doc tried to examine her and open her mouth, her remaining teeth fell out into his hand. It had eaten through the bones of her face, invaded her eye socket, everything. Doc said it was the worst case of mouth cancer he'd seen. According to her husband, she had a small lesion on her hard palate, and upon receiving the diagnosis of an early-stage squamous cell carcinoma, she decided to treat with essential oils and things like frankincense because chemo was poison. Her husband said he had tried to reason with her, but she was adamant about the natural treatment. She died in agony shortly after. You know I usually adamantly refuse to allow my happiness to be disrupted by stuff on the internet. But it's stuff like this that makes me feel justified in allowing myself to be triggered when I see someone I know on Facebook posting horrible misinformation from somewhere like Natural News. RN here, not a physician, but you may find this interesting. Young adult male presents with multiple abscesses on various parts of his body. States he injected his boyfriend's semen into himself trying to get pregnant. He tells one of the APCs he should have gone with his original plan and tried on his dog first. Psych clears him. He's admitted to the floor and gets IV antibiotics. What? I've seen enough of Reddit today. Medical professionals of Reddit, what is the craziest DIY treatment you've seen a patient attempt? Had a patient come into the OR with a makeshift bandage on his shin. He had fallen on rocks while hiking and left a 3-inch long, half-inch deep gash in his leg. I go to pull the bandage off, and as I'm peeling it away I notice the skin is completely black and there's dark chunks of fungus falling out of the wound. It looked necrotic, like it had been left alone for a week. I look at this guy like he's crazy as he tells me the wound is only a few hours old. He's pretty proud as he explains that he created a makeshift poultice by chewing up leaves and moss, mixing it with river mud and stuffing it into his leg. That's what all the black mossy stuff was. Hint, don't do this. Finally, something I can add to. When I was in med school on my family medicine rotation, I was sent in to see a middle-aged woman with complaints of sinus congestion. Sure enough, from the beginning I can tell she's really stopped up with her nasally voice, and my history and exam are consistent with your run-of-the-mill viral upper respiratory infection. I begin educating her on symptomatic management and the following exchange ensues. Patient: do you think it might be the flu? Me: it's possible but unlikely. It's really out of the typical season. It was June. Patient: yeah, I guess I wasn't sure it was. I've been spraying Lysol everywhere and it doesn't seem to be doing any good, and it says it kills the flu virus. Me: well, that's something that could help disinfect the house and keep the virus from spreading. Patient: I guess. I just wish it didn't burn so much. Me: what do you mean, it burns? Patient: you know, when I spray it up my nose it burns so bad. Yep. My patient thought that since Lysol kills influenza, the best way to nip it in the bud was to flush her sinuses with it like a saline spray. It did not work, for the record. The fact that I didn't immediately fall over laughing and instead seriously counseled her against ever doing that again is still the greatest featuring of composure in my entire career. TL. Doctor, when the label on Lysol says not for internal use, they mean it. Not for internal use. Now it says that. It was marketed as a douche and birth control in the 1920s. Parents sneaking essential oils onto their premature baby's skin. They have central lines. These oils can wick onto the line and damage the line, cause infection, or interfere with medications. Infections in preemies can mean death within hours. Preemies have incomplete skin with much faster absorption rates than fully developed adult skin. These oils can cause burns and damage their insides. Your pyramid scheme company is not a reliable source for neonatology treatments. Please, dear God, keep oils off of any baby, but especially preemies. I'm a dental student where we see mouths in pretty awful condition. One guy came into the emergency clinic with teeth half rotted off from decay and told me he has been putting gummy bears in the holes to make it less sharp on his tongue. That reminds me of the time when I tried to DIY a tooth from a Mentis because I had lost a tooth just before the day where we took school pictures. As a child I got really bad sunburn. The person looking after me coated my sunburn in baby oil to help it heal, and sent me back out into the sun. I realized when I was older why my mum went nuts. I have a Jamie Oliver recipe that directs me to do the same thing midway through roasting a chicken. White bread soaked in milk placed on an armpit abscess to draw out the infection. Needed an IND and a couple weeks of IV antibiotics by the time he got to us. Either that or the guy who crashed his motorbike, scraped his leg all to heck, and then decided the best course of action was to self-cauterize it on the tailpipe. Whoa, stupid or not, the tailpipe guy had a set of brass ones. Dental student here. We had a patient who declined a much needed cleaning, saying he could do it just as well at home with a scalpel. Didn't brush his teeth, but every few weeks he would go at the accumulated plaque and tartar with a scalpel. Same patient also insisted we do a procedure without local anesthetic. He was an amateur boxer and was building up his pain tolerance. He also told us he smoked 20 blunts a day and only drank Coke. We could tell. Worked in pediatrics for a few years, and we had this one family come in with a kid who was burned by one of those microwave ramen soups. They put duct tape on the now blistered skin to keep it from popping in the car. Not me, but my mom. Had a gentleman walk himself into the ED one day after he tried to give himself a vasectomy with an animal neutering kit he bought on the internet. When she asked him why, he told her that his wife wanted to have a 6th kid and it was too expensive to pay a doctor to do it, and how hard could it be to DIY. That is a man dedicated to not having another kid. So sugar can be used to help heal certain types of wounds. A patient I saw had missed an appointment with part of their care team where they get their bandage changed. I noticed what appeared to be oozing around the edges of the bandage. Asked my patient about it. Offered to change it for them. We didn't typically do that in our clinic. They said yes. I go get fresh bandages and whatnot. Take the old one off and it's just sticky and stringy. Picture the slow-mo shots of caramel being pulled apart, and it smelled. To be fair, most wounds smell, but this was different. I finally asked them what they used to change their bandage since I knew it wasn't discharge. Maple syrup. They used maple syrup. My grandpa thought a leg discrepancy was causing my back pain, which was causing spasms. He put several pieces of cardboard in my shoes to try to even out my legs, which were already even. He also thinks black beans cure everything. My dad thought those pesky spasms was a pinched nerve, so he would take me to the chiropractor, his girlfriend, to get my neck cracked when it happened. Seizures? People, they were seizures. Black beans are delicious and make a beautiful blue dye. That's useful enough for me. I'm hoping you get actual medical care now. Woman I know has a dog that is epileptic but was not willing to medicate the dog for some time. She kept trying holistic remedies, one of which she informed me about was giving the dog all natural vanilla ice cream during a seizure to stop it. You know, because you should always try to put stuff in the mouth of a seizing animal. It didn't work. The dog is on meds. Seizures are controlled now. Imagine that. Had a patient come to the ER for a cough. We did a chest x-ray that caught a little something in the abdomen pelvis. Did a pelvic x-ray. Long story short, she stuck a shot glass up her vagina for birth control, left it up there long enough for it to calcify, and we had to surgically remove it. One time, when I was in nursing school, I was doing a clinical and a guy came in with penile pain. Long story short, several days prior, he decided he wanted a penile texture implant to help enhance pleasure during intercourse for his lady friend. He and his buddy got drunk, of course, and decided to do it themselves. So they went in his garage and took a box cutter to slice open the skin on the dorsal top side of his penis, made some room between the skin and underlying muscle, and put a small porcelain heart underneath. Then he superglued it shut. To make matters worse, the guy didn't wait for it to heal and decided to take it for a test run. He ended up with a major infection and presented several days later. I unfortunately don't know the outcome. I was just there for the porcelain heart extraction. I can't make this crap up. I've now worked in a surgical trauma ICU as an RN for 2 years, and people never cease to amaze me. Putting a toy up the rectum to better reach another, larger toy. I just read the other day about a dude who got a toy stuck up there and then got the kitchen tongs he was using to extract said toy stuck up there too. Adult patient had gas and poked a hole in his belly button with basically a knitting needle to release it. I didn't think it was possible to ever cringe this hard. You've proved me wrong. I'm a doctor, but didn't see this firsthand unfortunately. However, my friend in ED saw a young 17-year-old boy that came in with personal trauma and mild blood loss. She trigged him, taking him to a room with his parents and asked what he'd come in with. His mom turned around and said, "Go on, tell the lady what you did." He then proceeded to tell her that he tried to circumcise himself with scissors for religious reasons as he hadn't been circumcised when he was younger, but had to stop halfway due to pain. Eventually the shame had grown enough that he had to tell his parents, who immediately took him to ED, some antibiotics and a revision by urology later, and he was able to be sent home. What the frick is wrong with people in this thread? My mom once melted Vicks vapor rub into my tea because she thought that would help my cold. It didn't. I know people who would do this. More than one of them. They'd swear by Vicks vapor rub and kind of treated it like a cure-all. A man who'd accidentally sliced his leg open at his workplace. He obviously figured that as surgeons use staples to close wounds, he'd cut out the trip to hospital and DIY with an ordinary desk stapler. Arrived in ED with a pus-filled wound with the odd discolored staple hanging off it some days later. Not at all DIY, but one of my friend's dad back home was a doctor, and he had a patient come in with 5+ snake bites, mostly on his hands and arms. The patient said he got bit by a snake and tried to catch the snake so he could bring it in for the doctor to identify it. Luckily the snake wasn't venomous. Patient came into the pharmacy and asked if they could use a plastic bag secured with a rubber band instead of condoms. Theoretically, you could. However, it wouldn't work at all and it would hurt. We had a guy come in with an abscess on his right thumb. When I asked him what happened to his hand, he told me about his recent deep sea fishing trip and was given the responsibility of cutting the fish with an open wound in his hand. A sliver of fish got in there and became infected as it healed. So this guy gets the bright idea of doing a little DIY wound drainage by grabbing his pocket knife and cutting it open, leading to a greater infection. Morgue workers, pathologists, medical examiners, etc. What is the weirdest cause of death you have been able to diagnose? How did you diagnose it? Work in a nursing home rehab. Guy essentially died from pooping. He pushed too hard, blood pressure dropped and that was it for him. I am a friend of a coroner's assistant. He spent a few months there. He said his craziest experience was when a man came in apparently expired. He was a little vague about how the guy ended up on his table with the coroner, but he'll chalk it up to being early in his career. He starts to do a standard Y incision on the torso. He stops early on. He noticed that the guy had slight active vitals. He looked at the mortician present and says, "Oh frick, this guy's alive." They determined the best way to resuscitate was to do an adrenaline shot. Now apparently he was declared dead but had something akin to pufferfish poisoning induced to his body. Anyway, the guy comes to screaming like a maniac and with his chest partially sliced open. He described the whole thing as surreal. Whoa, poor guy. I have heard firsthand of some bizarre causes of death. 1. Bee sting to the inside of the lung. A woman accidentally inhaled a bee and it stung her. Apparently she was allergic. Took a week to figure it out. 2. Cause of death was gunshot to the chest and ruled a homicide. Except he had been shot 3 decades earlier. A small piece of shrapnel from the bullet wasn't removed when he was shot, but he was completely fine for 30 years. Then it found its way into his circulatory system close to his heart, made its way into the man's right ventricle and caused a heart attack. The man who had shot him was sent to prison for a few years and released, but was subsequently arrested and charged with murder. 3. A man with a very weird fetish put a live eel up his bum, and it tore a hole through his large intestine. Died. Was the eel okay? Eel be fine. Friend is an autopsy tech. Apparently it's not uncommon for cats or small dogs to eat the hands and face off a dead or incapacitated owner. His worst was an elderly woman who was paralyzed, but not killed, by a stroke, and her little dog ate all her exposed skin before she was found. He did her autopsy after she died several hours after being admitted to the hospital. He did her autopsy after she died. Well, that's good, I guess. I'm a criminal defense attorney. Had a client charged with murder for essentially getting into a shoving match with a guy. No external bruising or scratching. No evidence of trauma anywhere. They opened his head and found a subarachnoid hemorrhage. Turned out he had a ton of booze and blow in the tox report. The coke had constricted the blood vessels and driven the blood pressure up, and the booze had thinned the blood out. When he bumped his head slumping back, that was all it took, and he blew out and was dead in less than a minute. Really sad case. I'm a criminal defense attorney. Username, public pretender. Ha, nice. My dad told us that they once had a guy bleeding out on the table from a stab wound. They stopped the bleeding but his vitals were still taking a dive. Someone points out there's too much blood. They turned him. It's coming out of his butt. Someone had stuck a light bulb up this guy's ass, broken it, and stabbed him when he tried to escape, and he still escaped. They stabilized him but he died of septic shock. This was told to us over dinner, mind you. Well, not a dead body, but I was a security guard at a hospital in Alaska. One of my duties was to bring deceased folk to the morgue, so I had a key to it. To get a radio call that some patient's wife wants her husband's wedding ring back. I assumed it would be on a deceased person. I go to the morgue to look for it. I look all over. No gold ring. I even opened the coolers. No bodies. I then look in the fridge. Body parts and a little igloo cooler. I look inside that. It looks like very old banana peels. I glove up and pull some out. Turns out this guy had gotten his hand shredded in machinery. I had to get the mangled ring off his mangled hand and clean it off and go give it to him. That's above and beyond the call of duty as a security guard. I'm an apprentice funeral director, but we had an autopsy tech come into my school once to do an autopsy demonstration. He was asked this very question and this was his answer. Male, mid-50s, presented with jaundice and other signs of alcoholism but supposedly no history of drinking. During preliminary observation, techs noted a red liquid coming from the anal area. Assuming blood, it was tested. Came back as red wine and blood. Turns out the deceased was a closet alcoholic who would give himself enemas with whatever alcohol he had. In this case, red wine. The doctors concluded he pierced part of his colon rectum with whatever he enamored himself with and led to a bleed. Assuming blood, it was tested. Came back as red wine and blood. Yes. An oaky start, with hints of plum and lower intestine. Complex hemoglobin finish that lingers on the palate. Edit. Thank you for the gold. I will spend it on fava beans. I worked briefly as a morgue assistant a few years back. The job mainly consisted of moving corpses and holding organs while the pathologist did his thing. By far the most WTF worthy death I saw was a guy who had been working in a factory, getting himself off by rubbing his willy on the underside of the high-speed conveyor belt he was meant to be operating. He got caught and it tore off most of his crotch. Ruled as death by misadventure. He had bled out, torn femoral artery, before the paramedics even made it to the scene. Death by misadventure makes him sound like a pirate or something. I've seen quite a bit. Working at the OCME has been a summer job that morphed into a side job while I'm in school. Two most unusual calls I've been on. 1. A man went to hang himself and when he jumped off of his apartment balcony he left so much slack that it took his head off. His head was on one lady's balcony and his body was on the ground. When we were there, we couldn't find the head, so we had to knock on a couple doors where the rope was hanging to in order to find it. 2. A man was sitting on the railroad tracks at a railroad crossing to commit suicide by train, where is very messy and annoying to have to pick up, mind you. But a drunk driver was trying to catch air over the tracks and killed the guy but threw his body off of the tracks before the train came a couple of minutes later. Met a man who told me how he had 2 nephews but now only had 1. I asked him what happened. Apparently his eldest nephew, around 28, was riding his motorbike on a weekend, out in the countryside here in the UK. They found him later that day, dead, on the side of the road, on a corner, motorbike next to him, with no obvious signs of impact or anything that could possibly have led to his death. It took a long time for them to work out what had happened. Eventually they found a small bruise about half an inch in width on his temple. After some investigation they discovered that the corner of road had just been resurfaced and had some loose stones on top. They concluded that as he rounded the corner at about 30 miles per hour, the bike had slid from underneath him. As he rolled to the side of the road, the footrest of the bike had entered the corner of the helmet through the hole where the visor was open and hit him in the temple, killing him instantly. Nothing reckless. No one else involved. Just bad luck. Sometimes that's all you need. I'm a nurse and this 80-year-old man had anal fissures and was admitted to the ICU because he shoved an entire frozen D-cell sized mag light up his ass and perforated his bowel. He went to surgery to have it removed and later died from septic shock. The mag light however survived. Those mag lights are awesome. Edit. For their durability. Brother and sister. 5, 7. Playing hide and seek in a hopper chest. Wow, after reading this I realized I could have been killed by one when I was around that age. Luckily my friend saved my life. We were playing hide and seek and I was literally taking stuff out to hide in it and he stopped me when he was passing through the room to find a spot. Whoa, just wow. Worked at a funeral home for a few years. First ever house call I took was to pick up a guy who died at home. Heard from his son that he hadn't been to the doctors in 20 years. We take him to the medical examiner and discover he had a hernia on his scrotum causing it to be the size of a football. We're not sure how he lived with that thing, but he was wearing jeans and a jock strap to keep that thing in. His toenails looked like dragon toenails as he obviously couldn't bend over to clip them. You know it's fricked up when the medical examiner calls another medical examiner on duty to say, hey dude, come check this out. My grandfather did some work as a doctor in Indonesia. He told us stories of people who'd had pathogens living in them and eating them from the inside out, some in really grotesque ways. Some people had fungus on them that basically sucked their lives away. Please don't refer to my wife as a fungus. The short of it, man died from endometrial cancer. Man had a transplant prior. Woman who gave transplant had metastatic cancer that had spread to said organ unknowingly. Man survived transplant but cancer cells from the transplanted organ populated and he ending up dying from her cancer. That is incredibly shitty luck. So my cousin and his best bud from med school wound up at the same hospital. His friend became a mortician and my cousin is a proctologist. One morning my cousin gets a call from a patient he had an appointment with later that day. Patient asks secretary if he could come in early. His issue was getting far worse. When asked what was wrong, he refused to explain and demanded to speak with my cousin. Now, my cousin has terrific bedside manners, the best I have ever seen. He makes it a point to speak with his patients whenever they need to. So he gets on the phone with this guy and the guy starts pleading with him. So my cousin had an opening and told patients to come in during that time. So patient comes in and is sitting in the exam room. My cousin walks into the room and asks him what's wrong. Patient proceeds to strip fully nude, get on all fours and stick his ass out at my cousin. While on top of the exam table, the guy began to explain how his butthole keeps leaking crap and it hurts really bad. Except my cousin apparently immediately saw that it wasn't leaking crap at all. The guy was leaking half of his goddamn intestines. Like, half a foot of intestine was just protruding from this guy's anus, and would throb and pulsate with every breath that patient took. At this point I wish I could say my cousin got the guy the help he needed. But before my cousin could do anything, the guy just screamed, just yank this goddamn crap out of me, man. Get IT out, as he reached behind himself and yanked his goddamn intestines so hard that his butthole erupted with a fountain of blood, coating the nurse and my cousin. That was apparently the most inhuman scream that Steven, my cousin, had ever heard that day. The guy was in so much pain after yanking his intestines out that he passed out and fell off of the exam table, smashed his head on the corner of a chair, and died instantly. So cue Steven's best friend, the mortician, does an autopsy. Cause of death was pretty straightforward all things considered, but apparently his friend found an unraveled slinky string throughout patient's digestive tract. Like, the guy took a slinky and ate it while straightening the metal out. All in all, makes me shake in anxiety just thinking about the whole thing. Doctors of Reddit, what's your thank God they came in for a second opinion moment? I can't count how many I was told it was a headache, but I just wanted to come in and have it looked at in case it was something else I've seen. Of course, those are the patients that are the nicest and are profusely apologizing for wasting our time. And of course, those are the patients that have a brain tumor show up on their CT scans. Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine, that were melanoma. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this: time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. I'm an emergency medicine doc in the Midwest USA. The patient was transferred from rural nowhere to our tertiary care facility. Big hospital with every specialist. Call was of really bad quality, but the transferring physician described a 21-year-old male that had rapid heart rate and breathing rate, low blood pressure, low oxygen, confusion, and a severe opacification on his chest. X-ray on the right side. Diagnosed pneumonia. He gave him a ton of fluids, started antibiotics, put him on a ventilator, but he wasn't getting better, and wanted to send him to us. Sure, send away. An hour later the gentleman arrives, and looks young, fit, and not the type to just drop dead from pneumonia. We roll him onto our stretcher and find a huge stab wound in his back. The X-ray finding was his entire right chest full of blood. We put a tube in it, gave him back some blood, and he had to go for surgery to fix the bleeding. Lesson: look at your patient. I am a semi-retired physician and I don't believe in second opinions. I much prefer two first opinions. This is an important distinction because often if the doctor forwards your file to a different doctor, they'll flavor it with their interpretation. 19 meters at the time, 33 now. I felt sick for about a week. Flu-like symptoms. Didn't want to eat. Just felt bad all over. One day at work I feel a very uncomfortable cramp tear in my abdomen. So I go to one of those 24 hours clinics. At this point I'm slumped over. Can't stand up straight without insane amount of pain. Just generally uncomfortable and hating life. After a few hours at this clinic, they say you probably have kidney stones. Go home, drink fluids, sleep it off. This seemed fine to me. I was ready to go home and listen to the doc. All was good. But my girlfriend at the time didn't last much longer than that, wasn't a fan of this diagnosis and drove me to the ER. Against my wishes, of course. After a few minutes at the ER, they determine my appendix has ruptured and I'm going septic. Apparently I was pretty lucky to not have died, though I did pick up bacterial pneumonia while in the hospital, so the recovery kinda sucked. Now I just have a crazy 6-7 inch scar on my belly to remind me to not avoid hospitals when I'm sick. I was like 10 and my parents took me to the doctor cause I thought I broke my leg skateboarding. He said it was a 3rd degree sprain, told me I'd be fine. I pointed out lines in the X-ray and he said they were nothing. I somehow convinced my mom to take me somewhere else and they confirmed I had multiple hairline fractures in my growth plate. I am always impressed when dogs go skateboarding and are clever enough to understand X-rays. A bit of background. In my field of audiology we have people licensed to diagnose not only hearing issues but balance disorders and other factors impacting listening and understanding. We also have another field who popped up when it was not considered as ethical for us to treat those more serious hearing issues. That is, with hearing aids. But they don't need the same doctorate level training, just barely high school or some college depending on jurisdiction. So I had a patient come in with a serious difference between left and right hearing, and this in itself is considered a red flag because both ears are exposed to the same things over time, and there are very few explanations as to why one would get so bad. The patient could hardly understand words on that bad side and the better ear was pretty good overall. Just minor hearing loss, perhaps age related. Immediately upon seeing these test results, the aunt and I agreed to send this patient for an MRI of the head because something was off. The patient confirmed no MRI or medical treatment had been recommended in the past and only hearing aids by this lesser trained hearing aid dealer, working for a popular US chain. The patient had been wearing these hearing aids already for a few years. The MRI results came back. Massive tumor on the hearing nerve. The hearing aid dealer is being investigated currently for malpractice, or more specifically a violation of state laws regarding red flags. I got a moderate traumatic brain injury in October, and the week after I got home from the hospital I wasn't acting like myself, was refusing to eat and just didn't make much sense. My mom called the doctor a few times. They said it was normal but to take me in if anything changed. She took me in on the Saturday a week later because I started slurring my speech and was unsteady on my feet. The injury caused my sodium levels to drop from 140, normal, to 119. This in turn caused stroke-like symptoms which were in reality a series of small seizures. Electrolyte imbalances are no freaking joke. Glad you're okay. Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had X-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he done goofed and that I would be talking to our mutual chief of clinical services about the incident. Symptoms were all in his head. To be fair, it was all in his head, and possibly spine. Took me a few years to finally get my MRI and multiple sclerosis diagnosis. It is a B to get taken seriously for, so thank you for that. Wife went to a for pain in her pelvic region. Ultrasound showed a mass. Probably an ovarian cyst, they said. It will pop in time. Leave it alone. Went to the doctor about a week later. Had a surgery to pull it out maybe a month later. Did a biopsy on the mass. It was ovarian cancer. She is now cancer free, but WTF. I had a guy come in for a second opinion after the first place didn't bother asking any medical history. Of course I took his history and asked more questions as we went. I remember telling him something felt off and we needed to run a test. So I ordered a peripheral vision test. When I got the test back I was shocked by the most classic tumor pattern I'd ever seen. 2 weeks later he was in surgery to get it removed. A month after this guy was back in my clinic thanking me. Totally different guy. Personality was a complete 180. Energetic and happy. Went to my family doctor with the worst headache of my entire life. She dismissed it, telling me it was a tension headache and that I should take a Tylenol and lay down in a dark room. Over the course of the next month, I saw her a total of 13 times, each time with worsening symptoms. First it was dizziness, then vomiting, then eventually I could no longer see out of my right eye. Every time she told me it was just a tension headache or a weird migraine, gave me a prescription for painkillers and sent me on my way. The final straw was when I was no longer able to walk properly. I would try to take a step, but all I could manage was this weird shuffle. She reluctantly agreed to send me to a neurologist. The next day I showed up at his office and was in there for less than a minute. He took one look in my eyes and immediately called an ambulance. Turns out I had hydrocephalus. My ventricles were 5x the size they were supposed to be, and my brain was literally being squeezed out of my head. Go figure. People get headaches all the time, but if you go back 13 times with worsening symptoms, serious malpractice. She could have at least told you to go see another doctor if she wasn't sure what to do. I think a lot of doctors just don't want to admit they're not sure what to do and that a second opinion is needed. No one knows everything and it's fine to admit that. Not a doc, but a nurse. At a clinic a lady came in for breast pain with a lump. I was in the room for the exam for safety of everyone. The doctor told her it was a sprained muscle and to go away. When he left the room I told her the name of one of our other doctors that specializes in women's health. Told her she could not let this go. She saw him and he referred her for some radiology and that's how they found her breast cancer. She later told us all this in a sweet card she sent telling us if I hadn't told her to advocate for herself she may not have followed up. A bulk of my career lately seems to be maligned patients with legitimate medical issues who've been labeled as hypochondriacs and sent through for a psych workup and meds counseling. People with histories of all kinds of endocrine issues, like thyroid cancer, thyroidectomy, patients who see someone once every 2 years about their thyroid and never have labs checked or med dosages fixed, or diabetics with poorly controlled sugars, people who've had bowel surgeries and take time release meds, and then wonder why they aren't working. The piecemeal system of healthcare in the US is really doing such a disservice to actual humans. So many specialists and no one piecing together the big picture. Bit of a weird one, because the request for a second opinion came from an intensivist and I was a contributor to their treatment plan. I work in poisons control. Had a call from a green, but very astute young doctor with a middle-aged female patient presenting with a vague 36-48 hours history of malaise, confusion, hypoxia from hyperventilation, and hallucinations. On workup was noted to have pulmonary edema, lung fluid buildup, metabolic acidosis, acute kidney injury, sinus tachy and raised CRP and WCC, suggestive of infection but no temperature. The initial diagnosis was sepsis. This keen-eyed doctor, pretty fresh out of med school, decided to do a salicylate level on this lady because the hyperventilation paired with metabolic acidosis and RQ was enough to prompt her suspicions of aspirin poisoning, even though they could just as easily be explained by sepsis as well. The level came back high. Not huge, but high, which prompted her to phone me for a second opinion on how relevant the finding was in terms of the patient's clinical picture. Simultaneously, the patient's family investigated the property and located numerous aspirin blister packs suggesting she had been dosing herself for chronic pain, which was present in the medical history. Chronic salicylate poisoning is insidious and has been referred to as a pseudosepsis in the medical literature as it often causes similar features. Comparing a high level in chronic poisoning to the same level in acute poisoning, features are much more severe in chronic poisoning, that is, pulmonary edema, hypoxia, etc. There is a disparity. We recommended certain treatments, all hail sodium bicarbonate, and the patient made a full recovery after a 2-week hospital stay. Whilst there was no question an infective cause was present and contributory, I was impressed with the Green Doctor's intuition and willingness to consider other causes. I feel like it greatly improved the patient's treatment. My grandmother had her hip replaced, but the hip always hurt to her. She waited a year, hoping it would go away, but it never did. She asked multiple doctors and did multiple x-rays, but doctors said the replaced hip was fine. We finally made her go to her private clinic in my hometown, and the doctor saw that the replaced hip was fine and dandy, but the bone around it looked like it was a tad bit eaten by bacteria. So the new doc did an operation, and there was so much pus in the leg it was insane. If my grandmother waited any longer, her blood would become infected and she would have died. Thank goodness she went to the clinic. A nurse here had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the doc. We suddenly and unexpectedly got a cardiac patient. This is some Grey's Anatomy crap. 22-year-old guy came in after seeing his primary at another hospital. His mom was my patient and asked if I would see him. I am an internal med doc. He had told his doctor he had a headache. I did the usual full review of symptoms since he was new, and he also marked his left testicle had a lump. Did exam and he had hard small lump on testicle. Knew right away likely had metastatic testicular cancer. One stat brain scan and testicular ultrasound later confirmed it. Asked him if told other doctor about the lump and he said yes, but the other doctor told him it was normal. I think the other doctor should get his testicles checked too if he thinks lumps are normal. Eye doctor here. I had a patient I saw several months before they came in for their visit, but well less than a year, which often means something could be wrong. In this case, as it turns out, nothing was wrong with her by way of complaints. She just wanted to get updated before getting some new glasses. We decided to just run the regular gamut of tests anyway, just because we might as well while she was there. She was a 50-year woman. Fairly normal exam. Perfect vision. Retinas showed healthy, but something about her pupils really bothered me before I dilated. We chatted about it and I asked her if she banged her head or anything weird and she said no, but suddenly reveals this crazy history of an old meningioma, a type of brain cancer she had removed a few years ago. She had decided to omit this from her history with us as she didn't feel it was important, but we went and put it into the charts anyway. Turns out she got a CT done 2 weeks prior to her exam with me, which she says turns up completely normal. I tell her she should tell her doctor about this anyway just to cover our bases. Fast forward. Patient shows up in my office ecstatic to tell me that my examination revealed that her tumor had returned with an incredible vengeance. She had no idea, was totally asymptomatic, and the CT she had prior to me showed what was very literally the size of a speck of dust, which the radiologist dismissed as artifact. On her return to her doctor, they decided to rerun the CT to cover their bases, and they found a quarter-sized tumor. Within 2 weeks the tumor went from the size of a dust particle to a quarter. She was rushed into emergency surgery as the tumor was growing super fast and was close to a blood vessel, which could cause a massive stroke. She had it removed that day and returned to me after recovery to tell me of what got discovered as a result of my testing. She is now a long-time regular patient I have been seeing for about 10 years. Medical professionals of Reddit. What was a time where a patient ignored you and almost died because of it? I am a nurse and I had a very polite and lovely patient trying to remove all manner of chest tubes and IVs after a motorcycle accident. He was obviously delirious from the pain meds and the head injury, but very nice still. I left him in the care of my co-worker for my lunch. 10 minutes into my lunch break I see him stagger past the break room door like something out of The Walking Dead, trailing blood everywhere, only to collapse out cold a couple of seconds later. Said he needed the bathroom. IDK how the frick he pulled his own chest tubes out. Removing them always makes me cringe, let alone doing it to himself. He was put back to bed, this time in the ICU, and got some more sedation, and even though him ripping it all out set him back a couple of weeks, he still discharged and came to say hi and thanks on the way out. The happiest delirious patient I ever had. What a bloody trooper. Haha. Had a post-cardiac surgery patient get out of bed, naked, and walk up to the front desk demanding to talk to the charge. Don't remember why. He unhooked his chest tubes from the suction. Surprisingly there was no bloody mess because he actually clamped them off. When asked about it later he said, well, I thought about pulling them out but it seemed like a bad idea. Had a throat cancer patient. We offered him surgery to remove the tumor. It was a fairly conservative surgery. He left because he didn't want a mutilating surgery and his daughter-in-law had been studying magnet therapy and she was quite good with it. His words. He came back a year later and was out of reach from any treatment. His cancer was so advanced that there was nothing we could do for him. Patient came in with syncope and general malaise. Found out she had a tiny patch of skin cancer on her ear, which she hadn't treated in over a year because she wanted to go to a different hospital to have it removed and just hadn't found the time. It metastasized to her brain, and I think other places. They gave her 5 months maximum. We had a college student come into the ER and had a wonderful case of appendicitis. He needed to get surgery ASAP as surgery is way easier and safer if done before it ruptures. He called his parents to let them know and they told him to refuse because he had a test upcoming in the week and they didn't want him to miss it. He left the ER against medical advice while we were all telling him that if your appendicitis gets worse and ruptures it can definitely lead to death. The kid luckily comes back about 10 hours later after it ruptured. He gets the emergency surgery and the amount of time he got to spend in the hospital probably doubled. Holy, those parents are beyond stupid. Had a repeat patient, not quite frequent flyer status. As a medic that would always call for a severe allergic reaction to shellfish every other month or so. She had always had the allergy and knew her reactions were getting worse. After a year, 6 or 7 calls of the silliness. My crew and I stayed in the hospital with her and talked at length about the situation since she'd always stay mum about how it kept happening. She told us she comes from a patriarchal culture and her father made this amazing seafood soup. If she didn't eat it and force her body not to reject his gift to the family she would lose her car, phone, or whatever punishment her father deemed necessary. We pleaded with her to do whatever it took to show him it was deadly and carry her EpiPens with her. Fast forward a few years when I altered course into nursing and joined that saw a familiar bloated face. Turns out she had gone off to college in another state and hadn't been home for a while, but had visited her folks for a holiday. Of course she had the soup and despite hitting herself with the EpiPen when her throat started tightening, the reaction continued. Her mom, who I had never seen before, told me she tried to eat it fast and rushed to the bathroom where she was found on the floor. Medics couldn't tube her in the field so tried medical management until they could drive her to our doc performed a tracheotomy at the bedside and she went to the ICU. Took a week for her to recover and I was told by the ICU nurses that her father finally got it, that her allergy was a real medical condition. Whoa, poor woman. Hopefully the father actually did get it because that is balls. Shellfish allergies are severe. Had a patient stop taking his heart failure meds in favor of drugs. Cause, you know, drugs makes the heart beat faster. Hahaha. We had a mom in the NICU who would constantly kiss her premature baby on the mouth. Several nurses educated her around why that's not safe for the baby, and thankfully documented their teachings. This was during cold and flu season, and became even more concerning when the mother was coming in with cold-like symptoms, coughing, sneezing and obvious congestion. She still continued to kiss the baby right on the mouth. The baby was almost ready to go home by this time, but got extremely sick. The baby ended up on a ventilator and had quite the extended stay with many close calls. I've read that the most common reason for a surgery to be re-performed is the patient not following doctor's orders during recovery. Doctor says, don't ride your bicycle for 6 weeks. Patient hears, don't ride your bicycle until you feel you can. Animal hospital professional. At least once a week we have to suture up a spay because the owners don't want to keep the cone on their dog cat and let them tear up their surgical site. Their organs are right there. Keep the dang cone on. I don't care how sad Luna is with it on. Then they yell at me because it costs money to sedate and suture an animal. Patient came to see me having a stroke due to a blocked brain artery. I'd activated the code stroke team. Everyone was ready in the theater to get the clot out of her artery. Nurses, anesthetist, technician, bitchy, 42, insisted on updating her Facebook status and checking in before allowing me to treat her. Wasted 5 minutes and 6-10 million brain cells, if she had that many to start with. Winner of the WTF award from me. Almost every day, you must not get up or you will die from embolus. Walks to bathroom to take a crap. Didn't die, but did lose an eye as a result. Young kid, 20, with bad diabetic retinopathy from uncontrolled DM type 1. Had eye surgery to remove blood and scar tissue from inside the eye. We told him to take it easy for a few weeks. He went to Six Flags. Roller coasters are bad. Retina completely detached. I got soft and painful. Had to be removed. I got soft. No. Please don't get up on your own. Then he gets up on own and pulls out line going into jugular that leads directly to the heart and proceeds to bleed all over everything until he pass out and almost dies. Again. No. No. One time at the VA after adult circumcision. Do not have sex or masturbate for 6 weeks. Decided to masturbate the next day. All stitches tore. When I was in medical school, had a gentleman in his late 60s come in for chest pain. Found to have a large heart attack. Very impressive STEMI and lad by EKG. Refused emergent cardiac catheterization, go through the arteries and put a stent to open up the vessel of the heart so he could bring his car home and planned on taking an ambulance back to the hospital. He was in the parking ramp and it cost $20 day to park. Came back by ambulance in full arrest, no pulse, and died. Doc had to call his son and explain what happened. He was like, yeah, that sounds like dad. He's always been cheap. Obviously what happened wasn't worth saving the $20, but that seems like really expensive parking. Friend told me a slightly overweight homeless woman was shooting in her butt and the spot was necrotic. She came in with sepsis and somehow standing and talking with what he could only describe to me as near full body organ failure. They stabilize her. Somehow she survives but is now missing half an ass. He said 2 years later she came back with her foot now rotting off from shooting in between her toes and on her ankle. Same condition, etc. Just now the leg. They amputate and he says somehow she survives again. Except 2 weeks later she is pushed back and on a wheelchair, drooling and nearly dead from overdose. Put an IQ. Son comes to visit her. At this point the hospital staff and my friend know her by name by the multiple visits. She hasn't seen her son in nearly a decade. He convinces her to promise to try to clean up for her grandchildren. Less than 24 hours later she ODs. Again, inside the hospital bathroom, somehow having snuck her kit in, nobody knows how. Friend said she was on the toilet with the needle in her arm, still warm, but very dead. Not necessarily the patient, but the caretakers at the facility where the patient was living. I used to visit different board and lodge facilities for adults with mental illnesses and meet with clients to discuss their mental health, help them set up job interviews, therapy sessions, and help them set up their medications for the week if they were unable to do it themselves. Most of these facilities were places for people who had left the hospital and were deemed independent and stable enough to have the freedom to come and go as they pleased in a shared living situation, much like a dorm. Despite having a place to stay and food provided, they were usually pretty poorly supervised by the mental health staff workers there. I often hated these places because, while they were ideal for some people who were truly getting back on their feet and thrived off being able to live a semi-normal independent life, they were way too lax for many of the sicker, more isolating patients who were not at all well and slipping under the radar. Some of this included them not taking their medication as directed, which was one of the requirements for keeping their housing, but unfortunately it was not strictly enforced. There was one man who had paranoid schizophrenia who was extremely quiet and kept to himself. I had met with him a few times and he seemed to be going downhill in his appearance and general mood. I spoke with his doctor and urged the facility staff to closely monitor him and his medication intake. as I saw in his logs that he often skipped coming in to get his medication at all. I was told that they were going to be sitting down with him to remind him of his living agreement and that he had 30 days before losing his housing if he wasn't med compliant. I was also told that his psychiatrist was aware and they may be sending him back to the hospital that week. Apparently this never happened and he went out into the community and acquired a knife and used it to slice up his roommate while his roommate slept. He carved him from mouth to ear and stabbed him in the stomach several times. The man survived the attack, but the man who had gone off his medication claimed he was being poisoned by his roommate through the window AC unit. For anyone with a violent incident like that on their medical report, it is incredibly unlikely he will ever be able to find a better rehabilitation house ever again that will accept him. The system basically screwed over 2 people that day, as the man who was hurt was already there for PTSD, and as you can imagine, it not only scarred him physically for life but exacerbated his illness with more trauma. That is terrible. Negligence created 2 victims and made them worse off. That is one of the worst stories on here. Eye doctor here. I had a patient who came in and on evaluation I determined that her diabetes was out of control by the look of her retinas, which required immediate intervention. I sent her straight to the retina specialist who then scheduled her for an OR. She decided that day not to go in because she had work and couldn't afford to take off. She was cleaning houses and the sprays made her sneeze, causing massive hemorrhaging in her eyes due to the weakened vascular state from the diabetes. She went immediately blind and got into emergency surgery that day. It took months of recovery and injections to reverse some damage, and she now years later has functional vision again. Her kidneys were also failing her and she had no idea. This kicked off a massive lifestyle change and a chain of doctor's appointments that saved her life, all starting from an eye exam. Patient was supposed to have starved for 8 hours for her morning scheduled breast surgery. During the procedure she regurgitated what can only be described as a full partially digested English breakfast, with identifiable sausages, egg, beans and possibly black pudding, up into her unprotected airway and attempted to inhale the lot. Managed to prevent the majority of it going down, but she needed HDU care for a day or so for her lungs to recover from the stomach acid. I used to work for a surgery center and the amount of morons who did this was astounding. There's a freaking reason you are told not to drink 8 hours prior to surgery. They have no idea about aspiration. When I'm told the 8-hour rule, I fast for over 12 hours. I dang well make sure there is nothing in my system to frick me up. EMT paramedic student here. So we had a patient who was morbidly obese and couldn't get out of his house. He decides after about 4 days of uncontrolled chest pain to call it in. Well, we get there and find evidence of several MIs but refuses care and wants us to leave. About 45 minutes later we get a call from the building he lived in and we got there and it was him in full-blown cardiac arrest. This man was so obese that we couldn't get him through the door and had to knock out a wall and lift him down off the 2nd story with a lift. All the while me and my paramedic lead were bagging him through an ET tube. Lots of firsts on that call. First ET tube I put in and first IO is ever seen done in the field. Butthole patient on a Centrimag. Basically a heart pump with hoses that draw blood from your heart into a pump next to the bed and brings the blood back to the heart through a different hose. As you could imagine, there is little room for movement since they could dislodge and you'd have blood squirting inside your body or outside. This guy was adamant he had to sleep face down. Well, he did, and then he died. I am on dialysis and one of the nurses told me about patients that after kidney transplants just will stop taking their anti-rejection meds after a few years because they think they don't need it anymore, and it's really frustrating for them nurses because the patients just ruined a donor kidney. Not a doctor, have worked in addictions field. Too many clients have died or will die because despite the repeated warnings from their doctor that they have almost no liver function or that what they're drinking is giving them all sorts of brain damage, they continue to drink hard. But a lot of these guys feel like they have nothing to live for but the bottle. It's really heartbreaking. This would be my father-in-law. At this point the alcohol is just slow working poison that is eating away at his body. You have been visited by the science doggo. Upvote now and you will get high grades and good results within the next week. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Or don't. Either way, have a great day you magnificent people.